afternoon, Miss Rana. I am Doreen Mobana and I will be performing head-to-neck assessment. First, gather all the equipment that is needed for this session, like
gloves, otoscope, tongue depressor, pen light, chart, pen, alcohol, and Snellen chart, and also include stethoscope.
first introduce yourself to the patient, then identify his name, and then provide privacy and sanitize by alcohol, and let's do the assessment. Good afternoon, sir. I am Doreen Magbanwa and I am your nurse for today's assessment. What is your preferred language po?
Tagalog.
Tagalog and English po? Okay. Can I get your full name po?
My name is Ismar F. Geraldo.
Ismark F. Iraldo. Birthday?
March 25, 2002.
Okay. Age?
Age of 20.
Okay, sir. For today's assessment po, in order to assist you for the head and neck assessment, I will ask for your consent po to touch you. Is that okay, sir? Okay po. Then, rest assured that all of the information that I've gathered here will be confidential within me and the attending physician. Sir, I will be conducting an assessment, a head-to-neck assessment, in able to know if there is an abnormalities or enlargement, lesion, or redness throughout your head. First, check the skin color of the face of the patient. As I noticed, the face of the patient was quite nice and tan color. Then the size of the head was accordance with the body. Then for the face, there is no lesion that I've observed, and the symmetrical face was not indicating a Bell's palsy or stroke. It was normal. And for the distribution of facial hair, his facial hair was less, like there. There is no infestation present. And then we proceed to the facial test, which is the cranial 7 test. Okay, sir? Can you tightly close your eyes for me? Okay. Then, smile. Okay. Frown. Okay. Um, like this po. Okay. As I've observed, there is no ease on his facial expression.
And the patient's cranial nerve was intact. Perform hand hygiene by washing our hands.
Next, I will do gloving in order to palpate his skull or head. Okay. Okay, sir, can you move here?
Abi na nakalimot siya itong anaon diri.
Next, inspect the external eye structure, eyelid, eyelashes, eyeball, and eyebrows, cornea, conjunctive, and sclera. Note the color, edema, symmetry, and alignment of the eye. Okay, sir? Look at my eye. Okay. The eyelids. Okay. Look up, sir. Down. Okay. Then, look at me, sir. Okay. After that, after noting the color, the edema, symmetry, and alignment, first, I observed that the eyes of the patient is color brown. Then the edema, there is no sign of edema. Then the symmetry is normal and aligned. Next, examine the pupils and acuity of the eyes and reaction to the light by darkening the room and using a pen light to shine the light of each pupil. To test the pupillary accommodation and convergence, ask the patient to focus on the object as you bring it closer to the nose. Sir, focus here. Then, again. Okay. And then, using the ophthalmoscope, check the rod reflex of the eye. Okay. Next, test the patient's visual acuity with a Snellen chart. Ask the patient to read all the smallest possible line or letters, then first with both eye and with one eye at a time.
With the patient's 2 feet away, ask the patient to focus on your finger and move the patient's eye through the 6 cardinal position of gaze.
E, D, F, C, Z, P.
And the 8th line?
D, E, F, P, O, D, E, C.
Okay. The 5th line, sir?
P, E, C, F, B.
Okay. And the 8th line?
D, E, F, P, O, D, E, C.
Okay. Another? The 8th line?
D, E, F, P, O, D, E, C.
The 6th line?
E, D, F, C, Z, P.
Okay, very good, sir. We are now finished in assessing the head and eyes. Next, we proceed to the ears. Okay.
Inspect the external ear bilateral for shape, size, lesion, palpate the ear and mastoid process.
Do you feel any pain, sir? Okay. Here? Here. Okay. Okay. We'll be using an otoscope. Okay. Can you move here? Okay.
May pagidungan to.
Okay. Do you, do you feel pain? Okay. Okay. Next, I will use a whispered voice test hearing for the assessment.
Apple.
Okay.
Orange.
Okay. Very good.
Then use a tuning fork to perform Weber's test and Rinne's test if the patients report diminished hearing in either ear.
After performing an assessment for the ear, we will proceed at the nose. First, inspect and palpitate the external nose. After that, palpitate lightly percuss over the frontal and maxillary sinuses. The external nose. Okay. And the maxillary sinuses. Okay. Okay. Exclude one nostril externally with a finger while the patient breathes through the other and repeat it to the other side. Okay? Sir, can I have that question? Okay, breathe. Okay. Other side. Breathe in and breathe out. Okay. Next, inspect the internal nostril using an otoscope with a nasal speculum attachment. Yes, sir? Okay, you're done. In assessment of the mouth is first, palpate the temporal mandibular joint by placing your index finger over the front of the ear as you ask the patient to open and close the mouth. Then, open your mouth.
Palpate the temporal mandibular joint
Close.
by placing index finger over the front each ear as you ask the patient to open and close the mouth.
And close. Okay. For the next step, perform hand hygiene and gun gloving. First, I will sanitize my hand by using an alcohol. Okay. So lips. Okay.
Inspect the lips, oral mucosa, hard and hardening palate, gingivae, teeth, and salivary gland opening by asking the patient to open the mouth widely using a tongue blade and pen light.
Okay. Next, after inspecting the lips, teeth, oral mucosa, and other, next, inspect the tongue.
Ask the patient to stick out the tongue. Place the tongue blade
Stick
at
out
the
your
side
tongue.
of the tongue while the
Okay.
patient pushes it to the left and right with the tongue. Inspect the uvula by asking the patient to say "ah" while sticking out the tongue, then palpate the tongue for muscle tone and tenderness.
Okay. Okay. the gloves. After assessment of the mouth, we will proceed to the assessment of the posterior neck. First, palpate the forehead to the posterior triangle of the neck and the posterior cervical lymph nodes using finger pads in a slow circular motion. Okay. Cervical lymph nodes, okay.
Inspect and palpate in front of behind of the ears, under the chin, and in the anterior triangle of the anterior cervical node.
Okay.
Inspect and palpate the left and the right carotid arteries. Only palpate one carotid artery at a time. Use the bell of the stethoscope to auscultate the arteries.
Okay. Okay. Done. We will proceed to the assessment of the anterior neck. First, inspect and palpate the trachea. Okay. After the inspecting the trachea, we will proceed to the thyroid gland. We will inspect and palpate it.
Palpate the thyroid gland, then if enlarged, auscultate the thyroid gland using the bell of the stethoscope to auscultate the arteries.
Okay. Next, we will inspect and palpate the supraclavicular area. Okay, ma'am? Okay, done. For the last step, inspect the ability of the patient to move his or her neck. Okay? Okay, ma'am, can you move your neck here? For the left side po. Okay? And move your chin to the chest po. Touch. Okay. For the clavicular area po, for the ear, move. Okay. Next. Okay. Then, we will let you... Okay. And we are done, ma'am. Thank you for operation. And have a good day. After that, we will perform hand hygiene. I will use alcohol to sanitize my hand. Then, document the finding of the assessment.